Do you know which type of spine you have? Everyone has a unique spine, but there are characteristics that are the same. Every spine has an S-curve, but the shape of that lower part can vary a lot. See these four spines? They're very different based on their curvature. So why does this matter? The type of spine you have can actually help predict what pathology and back pain you might develop. Patients who have a type 1 or type 2 spine have a higher risk of disc degenerative disease. But patients who have a type 3 or type 4 spine are more likely to have facet joint pain or a spondylolisthesis, which means a slipping of the spine. So let's look at the different types of spines. Type 1 is a short, steep curve. This is the least common, affecting only 12% of people. Type 2 is what's called a flat back. This is a minimal curve at the bottom. It affects about 22% of the population. And then type 3, this is the most common type. It's actually about 46% of the population. And the final one is type 4. You can see how deep and exaggerated that curve is. We call this hyperlordosis, and this affects about 20% of the population. Now, what spine do you think has the least amount of back pain associated with it? If you guessed type 3, you would be correct. This is actually considered the most balanced spine, and it's not to say people with this spine don't get back pain or disc degeneration, but in a population, it is overall the least likely to have back pain. So which spine type do you think you have?